Say goodbye to your regular routine and hello to the new joys and responsibilities of parenthood. We're going to share with you some important information to help you adjust to changing priorities and demands on your time. Let's get started as you and your newborn really get to know each other and establish a routine.
The information here is general in nature and not a substitute for the advice and medical care from your healthcare professional. If your pediatrician recommends different instructions that are specific for your baby, please follow your physician's advice. Your baby's follow-up appointment with a pediatrician usually comes 2 to 14 days after your discharge from the hospital, depending on how long you've been in the hospital, your baby's weight, and other factors. At that time, your pediatrician will track your baby's growth and development along with weight gain, jaundice, and feedings.
This is a bulb syringe and it's yours to take home. You will use it if your baby starts to choke, gag, or spit up. After using it, clean the bulb syringe with warm soapy water. You can also use it to suction your baby's nose if your baby is stuffy. Once you and the baby are home, family and friends want to visit you. But during the first few weeks, don't get overwhelmed by visitors. You also need to limit who handles the baby, especially other children. This will help keep your baby from getting sick. It's always a good idea to remind everyone to wash their hands thoroughly before touching the baby.
On average, a newborn baby weighs roughly 7.5 pounds. It's not unusual for an infant to lose 5 to 8% of their birth weight during the first few days of life before they begin to gain weight. Most babies regain their birth weight by the 10th day, double it by 6 months, and triple it by 1 year. Infant sleep patterns can cause new parents to see changes in their own sleeping schedule. Until 6 to 8 weeks of age, most babies wake up for a feeding every 2 to 3 hours during the day. At night, newborns will usually wake up every 3 to 4 hours to feed. Once your baby is above birth weight, you can usually let him sleep longer at night. Talk to your pediatrician about this. Each infant tends to set his or her own sleep pattern. You really can't do anything to change that, so you should rest when your baby sleeps. Most babies will begin sleeping through 1 or 2 nighttime feedings at 4 to 8 weeks of age.
Prevention is the best remedy for diaper rash. Change your baby's diaper as soon as possible after he or she wets or has a bowel movement. Apply a diaper rash cream or petroleum jelly after washing the baby's bottom with warm water. It's common for newborns to have a variety of harmless skin blemishes and rashes. Newborn milia or baby acne is caused by hormones and mimics teenage acne. Other babies may experience erythema toxicum or newborn rash. These are blotchy red areas on the skin. They usually resolve in a few days. You may also notice dry, peeling skin on your baby's scalp, hands, and feet. This is normal, and it's probably best to leave that alone because lotions tend to slow the elimination of dead skin. Your baby's first bath at home is a memorable experience. You will give your baby a sponge bath every 2 to 3 days until the umbilical cord falls off, and if you have a boy, the circumcision heals. Make sure you have all of your bath supplies ready to go before bath time begins. And remember, never leave your baby unattended. Using the corner of a washcloth, start cleaning your baby's eyes. Clean from the inner portion to the outer part. Use a different corner of the washcloth for the other eye. Use water to wash the baby's face. Be sure to clean around the nose and ears. Never insert a cotton swab into the nose or ears because this can cause damage, especially to the eardrum. For the rest of the body, use warm soapy water, cleaning every fold and crevice. A baby's skin can be sensitive, so don't use any type of baby powder. Other products such as shampoo, soap, and lotion should be fine. However, If a rash develops, call your pediatrician. Once you've rinsed the baby with clean water, then dry, dress, and wrap the infant in a blanket to prevent getting chilled. Don't cut your baby's fingernails for at least 2 weeks following delivery. If the fingernails are long and your baby is scratching his face, you can put socks on his hands to prevent this. Alternatively, you can use an emery board to file the nails. Remember to use clean water on the genitals. Baby girls may have some vaginal discharge. And be sure to wash from front to back so that stool is not wiped into the vagina. This will help prevent urinary tract infections. For a baby shampoo, wrap the infant in a towel and use the football hold. On the wet scalp, apply a little shampoo and wash, making sure to stimulate the entire scalp area. Then rinse with lukewarm water. If the baby develops cradle cap, contact your healthcare provider. Following the bath, swaddle the baby for warmth. Sometime between 1 to 4 weeks, the baby's umbilical cord should fall off on its own. According to your pediatrician's instructions, alcohol or clean, warm water may be applied with a cotton swab or cotton ball 3 to 5 times a day. The cord will look more like a scab as it dries. Don't pull it off, let it fall off by itself. But if you do see a bad smelling yellow or green discharge or redness on the skin surrounding the umbilical cord, call your pediatrician. Continue with sponge baths until the cord falls off. Then you may give your baby a tub bath.
If you have a baby boy, the choice for circumcision is a personal one. If you're not sure what to do, talk to your healthcare provider about the procedure. There are different techniques used for circumcision. Your nurse will teach you how to care for the type of circumcision chosen for your son. Clean the penis with warm water for the first few days. The tip may look red and have a crusty yellow appearance in some areas. Do not try to wash the yellow substance because it's part of the healing process. But you should call your pediatrician if you notice increased swelling, bleeding, or a yellow or green discharge.
Jaundice means that your baby's skin is yellow, and it's common in newborns. The yellow appearance in the skin and eyes comes from a normal body chemical known as bilirubin. Newborns have extra red blood cells reserved for birth. Bilirubin is one of the breakdown products of those cells. The newborn liver is fully developed, but it's not completely efficient. Additional bilirubin goes into the blood, and it's stored in the skin until the liver can process it. This is called physiologic jaundice. It's not harmful, and it usually goes away without medical treatment within a week. While in the hospital, your baby's bilirubin is monitored by the nurse. If the level's too high, your baby's nurse or your pediatrician will notify you. Your baby may need phototherapy temporarily to treat the jaundice. If the bilirubin level gets too high, jaundice can become dangerous and permanently damage the brain. So it's very important to keep your follow-up appointment with the pediatrician so that jaundice can be monitored after you leave the hospital. Your nurse will give you a yellow chart called a nomogram that has your baby's jaundice level. You will need to bring this to your baby's follow-up visit with your pediatrician.
In the hospital, your baby's temperature has been monitored regularly. That's not necessary once you go home. But if you think your newborn might be sick, is not feeding well, feels unusually warm, is inconsolable, you can take an axillary temperature under the baby's arm. The thermometer in the hospital crib is yours to keep. If your baby shows a temperature over 99.4 degrees Fahrenheit, call your pediatrician. Being a new parent can sometimes make you tired, frustrated, even angry. But no matter how stressed you may become, never shake or toss your baby into the air. Non-stop crying is the leading reason a baby is shaken. Shaken baby syndrome is serious because it can lead to brain damage, blindness, or death. If you are tired or frustrated, ask your spouse or family for help with your baby.
Going home from the hospital is a special moment, and you need a safety car seat for baby's first ride. Make sure your baby fits properly in that seat, which should bear the words dynamically or crash tested. It should also say it complies with the Federal Vehicle Safety Standard 213. The American Academy of Pediatrics recommends that infants should ride in a rear-facing child safety seat positioned in the middle of the back seat until they are 2 years old. Never put a rear-facing seat in front of the passenger side airbag. Once the baby is secure in the seat, check the strap. You should only be able to fit one finger between it and the baby's chest. Unless it came as original equipment with the seat, do not place a headroll in it. These have not been crash tested and are considered unsafe.
Rear facing in the back seat. Middle of the back seat's the safest place because you have the cushion of air on either side of the car. Rear facing helps protect the head and the neck.
If there is a base with the car seat, place it in the back seat and make certain it does not move more than 1 inch front to back or side to side. Always keep the window closed, the door locked, and never leave a baby unattended in a vehicle, not even for a moment.
Immunizations are a vital part of your baby's health and help protect against a variety of preventable diseases. These vaccinations start at birth and continue into childhood. Some pediatricians begin the hepatitis B vaccine in the hospital at birth, while others start giving it at 2 weeks. If your physician has recommended that your baby receive the vaccine, you must sign a consent form, and your child's nurse will start an immunization card for you and give it to you before you go home. Remember to take that card with you every time you visit your pediatrician's office so you can record and keep track of your baby's vaccinations in one place. Sudden infant death syndrome, or SIDS, is the leading cause of death among infants 1 month to 1 year old. The baby's sudden death is unexplained by history and remains unexplained following a thorough investigation. While SIDS is unpredictable, here are some ways to help reduce your baby's risk. This information should be shared with family members and babysitters. Before you go home from the hospital, your baby will have a newborn screening, which tests for 29 genetic and metabolic disorders. Your nurse will give you the front copy of the test to bring to your pediatrician's office when the test is repeated at 2 weeks. This blood testing is important because it looks for inborn genetic and metabolic disorders. Left untreated, they could cause brain damage and possibly death. Your baby's hearing will be tested before going home. This helps to identify potential problems that might require further examination. If your baby doesn't pass the first hearing test, a rescreening is performed. If the infant does not pass the second test, you may be referred to a hearing specialist.
Even experienced parents sometimes wonder, is this normal for my baby and do I need to call the pediatrician? Here are some signs and symptoms that can be a reason to call a healthcare professional. And if your baby turns blue around the mouth or lips, you need to call 911 immediately.
Although this may seem like a lot of things to remember, don't let this information overwhelm you. Enjoy this time with your baby. because it goes by fast. Again, congratulations and welcome to parenthood.